As we continue our conversation on the role of innovation in healthcare, our first panel of the day will dive into the role of data and AI and how recent technological innovations are transforming health tech discovery. It's my pleasure to introduce our moderator for this panel, Dr. Nasim Afsar, a UCLA Anderson alumna from the class of 2017. With an MD from UC Davis and an MBA from UCLA Anderson, Nasim has dedicated her career to advancing health and care of the world through healthy people, healthy workforce, and healthy business. As former Chief Health Officer at Oracle Health, she led efforts in product strategy, global market entry, and partnerships, directly improving the care of millions of people while saving healthcare practitioners time and positively impacting her clients' financial performance. Thank you so much for being here today.
Thank you.
And we'd like to invite the panelists to please come up and take a seat.
Thank you. Thank you so much, Emma. Good morning, all. Good morning. All right. I love the energy in the crowd. Welcome to Vitals 2025. I'm Nasim Afsar. It's an absolute honor to be here this morning at Anderson to continue the great conversation around how do we lead and advance health and care across the globe through innovation. I hope you all didn't fill up too much on breakfast this morning because we have got a number of bite-sized innovations for you to talk about. Thank you for laughing at that. My kids didn't think that was clever, but thank you. I appreciate that. Jody thoughtfully laid the stage for us about the challenges that we have in healthcare, and she also gave us a very strong call to action around what needs to happen. So we are going to build on that with our insightful panelists here today. And I'm going to ask you all to take a seat and we'll get started. All right. So to kick off the conversation here, we're going to start off with some brief introductions because I know you all have your devices out and you're looking up everyone. So we're going to do brief introductions. And if I could ask each panelist to highlight for us what's a way that you see AI fundamentally changing healthcare? Start here.
Sure, absolutely. Thank you for the question. So first off, my name's Nick Paladino. Thank you guys for having me here today. I've spent about the last decade or so working in various roles in med tech companies. I've had roles in commercialization as well as product marketing and product management. Currently, I'm at Dexcom as a leader of corporate strategy. So when you talk about how it's going to change, and I think some of the exciting things that are going to happen, the thing that comes to mind for me that's been consistent throughout my career is seeing us be able to reduce the burden on healthcare providers on administrative tasks. So, and I'll give you an example from when I was working at BD. One of the things that we saw a lot of was pharmacists and nurses who have spent years and years getting specialized in school to take care of patients, spending a lot of time managing inventory. And I mean, a room full of business school students, I'm sure some of you, supply chain is like your favorite thing. Well, for pharmacists, not so much. So at BD, we did a lot of work with AI to help them optimize inventory without having to do that manual work so that they can focus more on patient care. And I think that's a trend that we're going to continue to see and something that I think is very exciting for the future of AI.
Thank you.
Hi, nice to meet everyone. My name is Paul Lukac. I'm a pediatrician by training, and my role at UCLA Health, I'm the director of applied AI. And so what do I do in my role? I co-chair what's called our Health AI Council, and that's responsible for governance of any models that go into use at UCLA. So we're looking out for things like bias and risk and what have you, and just making sure the models perform well. I also am in charge of many of our implementations of some of these new generative AI types of features that touch the physicians and touch the patients. So all of this very cool stuff that everyone is so excited about. If I were to answer that question, I would say that I think people will begin to appreciate the environment of the delivery of healthcare will change. And what I mean by that is I think there will be less friction, and it will be kind of a more wired experience. I'm sure everyone struggles with scheduling a specialist appointment and making sure the referral went through. I see that becoming much more automated, that you'll see more of these like agentic AI chatbots that will work with you a little bit better. On the provider side, when you're going to see your doctor, this is already happening where there is a device in the room that is recording the conversation and writing the note. So no longer is your doctor going to be staring at the computer for the duration of the visit. And so that will return some humanity to those visits. So yes, change in environment, hopefully less friction, which has been an issue for far too long.
Thank you. So my name is Eleazar Eskin. I am the chair of the Department of Computational Medicine, which is both part of the School of Medicine as well as affiliated with the School of Engineering. And so the department really focuses on supporting research programs that advance technology in health and biomedical science. And we work a lot of our faculty work on AI and health type problems. I'm actually a member of the committee that Paul chairs. So I have kind of a broad view of what a lot of people are working on and where things are going. But I would say that you don't even need that. Last week, right? Even just last week, tools came out that are accessible to the public that are completely transformative in the sense that you can take your MyChart app, take all the data from that, upload it into this deep research, right? And get all the information that you would need. And there's people that say that they perform better than I don't necessarily believe that, but I do believe that patients will do this and come to their appointments, right, with this output and saying, look, this is what my AI model says, right? So I think that's going to be completely transformative, and it doesn't require all of that we deal with is how to implement governance, all these challenges that make everything move a lot slower. That can start next week, right? So I think that's going to happen very soon.
So lots of potential for how we can fundamentally change health and care for the generations to come. And if all we needed to advance healthcare was better tech, we'd be much further along than we are today. We know that in addition to great tech, we also need to have the cultural transformation that's required to embed that technology and actually get some of the gains that we want. But the healthcare environment is highly complex, as again, Jody highlighted. We need this ecosystem to come together and collaborate to be able to move forward. Can you share with the audience what are some of the opportunities that you see for collaboration within the healthcare ecosystem as we move forward? And Nick, we'll start off with you.
Sure, yeah, absolutely. So selfishly, because I've come from a product development world where I see a lot of the big opportunities is healthcare providers like these gentlemen partnering with R&D at corporations to help us tailor the types of offerings that they need. To your point about kind of that user trust piece, I think that's where we really are able to hone in and understand and bring better products that our end users actually want to use, things that kind of help augment their bandwidth as healthcare providers. So I think that there's a lot of potential for partnership there. It's something that at each company I've worked at, Dexcom, BD, Nuvasive, we've always had very close relationships with either physicians or nurses, whoever our end users were, to help us tailor what the AI solution would need to look like and what would actually be helpful. So I think in order for us to make this adopted more quickly, in addition to like the regulatory barriers, but I think this is a big one in terms of end user trust. And I think that's how we get there, is partnering together.
Yeah, I'll answer this through the lens of governance and regulation. And by its nature, healthcare is very conservative and risk averse because we have to be. We're dealing with protected health information. And I think, over the past few years, there's been a shift toward figuring out how to handle AI and coming up with risk frameworks and what have you. And I think it's clear to everyone that technology alone, the tech industry cannot be left to their own devices to monitor their tools. And so there will be a collaboration amongst health systems and government and industry to come up with best practices and really make sure we are doing AI responsibly. And again, I just wanted to add, we can't really depend solely on the government here either. The FDA is responsible for approving AI as a software, but they treat it like a medical device. So a medical device, a bedpan in a hospital is a medical device. So it's not, it can't be done by one, it has to be done by all.
So that's I think actually Paul is the real authority here because, he's literally, at the running the committee that kind of not regulates or just coordinates, access of, industry products to the health system. And I would say that that's actually been a fundamental challenge, right? Is that if you look at what the successes of AI, like these AI scribe type things, right? They're great because you just put the device in the room. It doesn't require any access to the information. It's just generating it. The limited, kind of implementations of these AI tools, they tend to be things like, like Epic or a company that's already inside the system. They have their AI tools, right? But if you think of the vast majority of startups, right, that have, if many of you might be thinking about starting companies in AI, right? Your challenge is you might get some data, right? But that would be like an extract. Or you might get some public data. You might get some, something. Even the big players get Google can negotiate data from a whole health system or Flatiron. But the integration of these innovative companies into the, into actual working into the health system and having the will of the health system to actually work with them and integrate, and then the tremendous costs it would be to actually do the integration. That's, I think, by far the biggest barrier in preventing, limiting really only a handful of players can actually, get in.
Great. Because we have such a diverse group here on stage, I want to kind of double click on each of your expertise and ask some specific questions. And Eleazar, we're going to mix it up. So we'll start off with you this time. So your research involves computational work, really kind of deeply understanding how we leverage genetic material. What are some breakthroughs that you're excited about by leveraging AI?
So it's really funny. Like my field was like the most exciting thing until like 6 months ago, right? I think it's still exciting, right? So, there's been a tremendous, driven by technology development, the ability to measure DNA extremely sensitively and extremely low cost. And that's really transforming healthcare, I would say, in 3 different areas, that's, coming to market. One is, just getting, UCLA and other health systems are all systematically collecting genetic information on all their patients from remnant samples. You do a lab, you can consent to have this done. And now they have, tens of thousands, maybe 100,000 of the patients at UCLA, their data is available, their genetic data is available for research, and now they're moving it to more clinic. And so from that, we will have what are called polygenic risk scores, which are kind of looking at your whole DNA, your whole genetic profile, and identifying what conditions you're at risk for. And some of those risks, are more informative than like lab tests, right? Like cholesterol level is, not that much more informative for heart disease than your genetic profile. So these will be really transformative. That's one thing that's happening. Another area is these early detection of cancer from germline, just blood tests. The idea, companies like Grail, they obviously had a complex regulatory issues, but companies like Grail and many competitors, the idea is that you'll do an annual blood test and they would detect cancers, a couple of years before they would be detected otherwise. And then the third area I would say is infectious disease. Actually, if any of you were here, I know the students know, but the faculty remember the pandemic. So we ran the SwabSeq project, which was COVID testing lab at UCLA, developing this test based on next generation sequencing technology. And so the next generation of that is going to be very low cost diagnostics that can detect any pathogen, for a fraction of the cost that it takes now. So that's already here. It's just now the regulatory, FDA approvals is what's necessary. But those three areas are, they're here, right? So there's tremendous opportunities for that. And that's not even, thinking about other ideas that these technologies can enable.
Eleazar, you're among friends, so we still think your research is super cool. I'm curious, you talked about some really major areas in healthcare, like cancer detection or being able to be more proactive in a pandemic situation. Are these solutions ready to scale? Like, what does this look like to scale to be able to serve the population broadly?
Yeah, well, so the first thing I talked about, which is your risk profile, right? That's really easy because it doesn't change, right? That's like, even the UK, I think, has some program where they want to collect, the DNA, the genome of every baby that's born. So, that's actually very, very low cost compared to anything else. The cancer diagnostics, I think it's maybe $1,000, right? I think it's more of a, treating cancer is so expensive, right? So if they did that, on everybody, they would be saving a lot of money. But it's one of those issues where, the money is not there for preventive care, right? So I think that needs to be worked out. And in terms of the diagnostics, the genomic-based diagnostics, they're a tiny fraction of the price of the current diagnostics, right? So there'll be a lot of savings there. I think it's just, it's a testament to the fact that the technology is transformative, and its cost of measuring things is like 1/1,000,000th of the cost of the current technology, right? So that's where the savings comes from.
Makes it a lot more accessible and scalable. So Nick, we'll come back to you. You have been working in the R&D space for over a decade. So I'm really curious about how are you seeing AI impact the design, development, testing, and kind of getting products to market? How's that changed?
Sure. So I think it's been an interesting evolution, and I would point to a couple of things that I'm seeing shift over the last 10 years. The first one being the maturity of the technology. The second being availability of talent to actually work on it and develop has changed pretty significantly. And then the last piece being the trust of the end users. So I'll give you a couple examples from my career. So when I was at Nuvasive in 2018, I was responsible for the imaging portfolio, and we had a really awesome technology that could take 2 images from an X-ray in an operating room and basically enhance the pixels. So it was an early stage AI type of algorithm where it enhanced pixels. The challenge with it was we had a really tough time finding anyone to be able to work on it and actually develop code. At that point, it was pretty much if you could do software development on any type of AI, those folks were working at Google, they were working at Apple, or they were contracting and they were pretty much writing their ticket to do whatever they wanted to. So we could get contract hires for short periods of time. But it definitely slowed down our development, having kind of the inability to keep somebody on full time and iterate. The other challenge was there was a lack of trust from the end users, especially because it was an imaging device used in the operating room. Surgeons were kind of your end user. So obviously visualization of the anatomy is the most important thing. So having that trust in an AI algorithm that it's operating correctly in the background and it's showing them what they need to actually see was a barrier. If you fast forward a little bit, a few years later at BD, I was working on the Pyxis portfolio, which is for medication management. And the technology became a little bit more advanced. It was a little more commonplace to talk about AI in healthcare. Certainly easier to find talent, even if we had to hire globally to have people develop code. And we moved to more of like a focus on predictive analytics. So think kind of the next level of depth in machine learning. And there was a lot more trust at the time from our nurses, from our pharmacy practitioners in the software's ability to help them optimize inventory, which made a huge difference. And I'll speak a little bit about what I'm seeing now in the diabetes space in general. We're moving to more depth again, where we're potentially going to see some like generative AI in the way of like coaching, for example. So one of the things I'm really excited about is to see glucose monitoring and some of these other tools that have been really reserved for type 1 diabetes in the past start to move into the wellness space. And with that, we'll start to see things like glucose monitoring insights that are actually actionable for the average person, right? So, for example, I'm wearing one right now. It's very upset with me for the amount of creamer I put in my coffee earlier. and eventually, we'll be able to have it sort of diagnose what maybe your macros were from the meal that you just ate based on your blood glucose levels. And in order to get to that level, you have to have a lot of folks working on it that are very talented individuals, obviously. And you also have to have a lot of trust from your end users. And now we're getting to that place where a lot of folks in the room probably already use Microsoft Copilot, ChatGPT every day, versus 5 years ago, that wasn't the case. So now it's become a lot more commonplace, and I'm seeing it move much quicker than what it used to even 3 years ago.
Yeah, Nick, it occurs to me that transition from one size fits all to providing customized and personalized insights is going to be a key piece in driving behavioral change. But as you mentioned, at the core of that is trust, and you kind of mentioned that briefly. I'm wondering if you could just give us a little bit more on that, since it's such a critical covenant in healthcare. What has contributed to that building of trust from the consumer?
Sure. So I think it's a couple things. I think early on, when we started talking about AI in healthcare, and still to this day, there's a lot of talk about it replacing healthcare providers. And I think that thankfully the narrative has shifted a little bit to helping and being more of an assistant role versus this sort of all-knowing thing that we're building. So I think that's a lot more digestible and I think more realistic as well, in my opinion. I just don't think that we'll get to the point of ever replacing folks that went to med school like this panel with an AI. I just don't think that makes sense. Like Paul touched on, there's that personal piece of healthcare that you have to have. So I think that as long as we're infusing that still with our tools and there's that kind of collaboration between the two, it helps. And then you touched on the behavioral component as well. I think that's going to be the next sort of evolution and the next challenge that will come, is that we're getting to a point where access to information is ubiquitous and we can get a ton of access to whatever we need to know about our health data. The next challenge though is, do we actually apply it, right? It's the CGM can tell you what's going on with your glucose and recommend meals for you and all sorts of things, but there's still the behavioral psychology component. And I think that's where, without physicians to help facilitate that with patients, it won't get very far, and the tools have kind of limited utility. So I'm interested to see kind of where that goes as well.
Got it. Thank you, Nick. So for all of you physicians in the room, you heard it here. Our jobs are all safe. If not, you're getting Nick's number at the end of this, and you just talk to Nick. So with that, Paul, you've been at the forefront of how do we implement these AI solutions in a large healthcare delivery system through the AI Council. So I'm wondering if you could share with us a little bit, how are you seeing healthcare delivery system respond to and change with the implementation of AI?
So I think it's a multifaceted approach. I think it's you really have to start from the bottom, which we're not doing yet, but it starts with education of the workforce, because you need to have an AI literate workforce. And in medicine, for physicians, that will start in medical school, it will continue throughout your career. You need to understand what you're using. And it's not limited to physicians, that's also patients. We need to make sure patients know what is a safe and trustworthy source to get their information. The second part that goes into that, the burden of the health system or, partner health systems and our peers, is we need to come up with a uniform way to safely vet these tools. And it's not just a one-off thing. You can't just say, okay, yeah, this vendor did a demo for me and it performed very well on this data set that they used from Australia. You don't know how that's going to work in your system. So you have to have a plan in place, and then you have to continue to monitor that technology once it's out there. The other part is sort of kind of a transparency element that goes into trust for the end users. And so when a physician is seeing the output of AI, they need to know, they're not necessarily going to know how that came into being, like, why did that happen? But they need to know what fed into that, what dictated that suggestion. And there are ways you can do that, certainly with generative AI. You will see a lot of instances where if it's giving text back to the physician and it's summarizing something for them, it will cite within the patient's chart where that information came from. For imaging, for example, imaging is a very big field for AI. You can do things like heat maps, which is a probability of what it's diagnosing. Like if it's red, it's closer to 100% that this is what the AI is telling you that it is. And that's the same case with patients. We have to have a comfortable level of transparency such that they understand that we trust it and how it contributes to our decision making. But then there is a degree where you go overboard and it's too much information. And then you can have some pushback then, I don't want this at all. So that's a delicate path. And then I wanted to say, lastly, a very important aspect that's specific to generative AI is human vigilance and being very aware, and this ties back to education, that it is ultimately making predictions. And so, yes, it can make things up, can say things that are totally not relevant. And you have to be, as physicians, we have to take accountability, because ultimately we are trusting this, and you need to still continue to be skeptical, probably for the foreseeable future.
Yeah, so many critical points. I want to double click on the piece around education. And I think, one of the things that I've been really impressed with Anderson over the years is how incredibly responsive the organization has been to the changing fields and industries to make sure that education is continually up to date with where things are. Unfortunately, in medical education, we lag far behind in really updating what we are teaching our future physicians, nurses, and caregivers. And I think a lot of what you're talking about really needs to be embedded at the time of training in how people think, how they learn to interpret, have a critical and analytical eye about the outputs that they get from their AI. It really needs to kind of happen at the educational level.
Yeah, totally agree. If anyone is a baseball fan, this is like our Moneyball moment. We're 2 decades behind baseball, but it's, they do spin rates now and what have you. But we really need to be more in tune with the changing dynamic of being a physician. There's this great stat that I like to sometimes regurgitate. In 1950, it would take 50 years to double the amount of medical knowledge. In 1980, it was something like 7 years. In 2020, it was like 73 days. There's too much knowledge for us to keep up with. And so I think a great addition that AI brings is it takes care of some of the simple and normal stuff and it can allow physicians to then focus more on some complex issues.
We have long surpassed the cognitive capabilities of human beings to be able to process, integrate, and be able to then synthesize how we need to actually take care of patients. On the human vigilance part, Paul, because you kind of live and breathe this space, I'm curious. There is tremendous kind of governance that has been built at UCLA Health as a again, forward-thinking, top academic medical center. What are your thoughts as all delivery systems, many delivery systems across the U.S. are looking at implementing solutions, and that human vigilance and expertise that exists at a top academic medical center is likely not going to be there? What are the solutions for those groups?
Yeah, that's certainly a problem that's on everyone's mind, is that this is only going to push wealthy academic medical centers further ahead of our rural counterparts. And there is the concept of doing sort of testing of various AI models through this, what's called an AI assurance lab, which is, say you have a regional group of hospitals and they pool data, and then you invite vendors in to test their models and do like real world simulations of that model. And then the vendor goes out and they have that information that's much more trustworthy to provide to a partner. But even then, say you have a rural healthcare system, how are they even going to afford some of these tools? Part of this will ultimately rely on, I think, government supplements. Same with EHR. That was a huge effort to get EHR everywhere. And there were economic aspects of that where they helped get it to rural health systems. So that's the same here. And we'll see what happens. It's a very changing dynamic on the federal level.
Thank you for that. So I want to ask you all a couple of rapid fire questions. Before that, as a reminder for the audience, we would love to hear from you all if there's questions that you have. So please get your thoughts going on what questions you want to ask, because after the rapid fire, we're going to move over to questions. We have a question in the back. Please stay. We are family friendly. All right. Nick, what are you most excited about with the innovations that are happening in AI?
I think in the immediate term, diagnostics is what comes to mind. So Eleazar touched on it earlier, but I think the genomics research that's allowing us to move to personalized medicine, and also the imaging research that's happening, the fact that we have AI assistants that can help diagnose issues from scans. I mean, even what our keynote brought up earlier, about diagnosing osteopenia in a patient that probably wouldn't have been traditionally thought to have it. I think we're going to start to see a lot more of that, and that's really exciting.
That's wonderful. Paul, what are you most excited about?
I'm bullish on agentic AI, which will make us a little uncomfortable because we'll have to be tolerating more autonomy for AI. So for a physician, maybe what that looks like is you're in the electronic health record and you have this little chatbot that says, oh, I see, this person needs a refill on their medication. Let me tee that up for you and add the diagnosis. And for a patient, what does that look like? Instead of being on hold at a call center, maybe you just go to the website. You have a chatbot with a lot of agency who will say, oh, yeah, this specialist that you need is closest by to you and they speak Spanish, and they have an appointment available in 2 weeks. I'll also add you to the wait list for any cancellations. So that kind of stuff.
Mm-hmm. Yeah, I think that kind of builds on Jody's concept of the customer as the CEO. You are at the consumer of health and care is at the center, and you have agents that can now help facilitate, translate, and be able to move you forward on your health and care journey. Eleazar, what are you most excited about?
I mean, there's many, many things. I would say that I'm going to say something a little different just to throw something else out there. I think that the AI is also fundamentally transforming the tools that people use to develop technologies. I'm capable of doing as like a, very limited time to do software development. I'm able to do a lot of software development myself now, first time in, maybe 10 years. And that's one area. And in particular, I think that, the transformations in robotics, particularly around the vision systems of robotics, I think will have unbelievable impact on all logistic, type processes, right? So, tracking people, you can set up cameras and then very quickly say, who's coming here, what rooms are empty, all this kind of stuff, just from passive vision. I think that's going to have tremendous impacts on all kind of logistics, because a lot of the healthcare is logistics.
Like giving us sights and insights where we're not. That's great. So we'll start back up with you, Eleazar. What are you most fearful of as we look at AI innovations?
Nothing. No. I mean, I think that I think that there's a lot of issues that could come up, and I think that we're actually doing a pretty good job of, like the governance issues, the bias in AI. I think we're pretty much on top of all of them. I mean, there are people who are fearful that these AIs will, kill all of us, right? So that's a separate fear. Right? I'm not getting into that, but I actually think that there might be some unknown dimension that we don't understand, like we didn't know about bias in kind of machine learning models until we discovered it. So there might be something like that, but I would say that we're doing a pretty good job of the ones that we do see and having structures like need to mitigate.
What are you most fearful of?
Yeah, there is an existential answer to that, but I'll just stick with the medical one. My greatest fear is that the uses for generative AI and LLMs will just like pick at the margins, and it won't be stuff that really changes things. It'll be like revenue cycle and I like the scheduling appointments, but that to me is still picking at the margins. And that would be a shame. And you're already seeing like some of these weird examples. For example, insurance companies who are using AI to reject services or claims. And then on our side, we're developing AI to do like prior authorizations or to fight back, So
AI versus AI.
That may end up just adding cost to our already overly burdened and costly model of healthcare.
Yeah, again, I think as Jody pointed out in the keynote, the time for incremental change is over. We do absolutely need transformative solutions. And Paul, I echo your concerns around there is a lot that we're doing today, and part of that is because we're learning, but part of it is because this is how we move in healthcare. We move very incrementally, but the stats don't really support us doing that. So
I don't think any of these things are bad things. I think they're excellent, and they will make things less friction. There'll be less friction, like I said. But 5 years from now, if it's still doing the same kind of stuff, that would be really disappointing.
Nick, what are you most fearful about?
So I guess not fearful necessarily, but
you have to do fearful, my friend.
Something we should all be cautious of. How about that? Building off what Paul said, I totally agree. I think that if AI is just scratching the surface, we're limiting ourselves. And I think the reason for that would probably be because we are afraid of what it's capable of doing. I think I'm a little bit fearful that society may overreact to it being inaccurate, or things like, the regulatory environment, like those sorts of things. That's what I'm a little bit more fearful of, is that we're going to say, this is powerful, we don't know what to do with it, and kind of put it back in the box, so to speak, versus working through it. But overall, I'm very optimistic.
Wonderful. So final rapid fire question from me. We are at a university campus with the future leaders and innovators. What's one advice that you have for them, Nick?
Be adaptable. I think that's what we really need for future business leaders. Information is evolving so quickly. And I think we need people that are able to react to it and change and be willing to upskill and change their views based on new information, because it is just, the cadence is so fast.
Love that adaptability, Paul.
Yeah, I would say go into healthcare, IT, analytics, administration. It is a Wild West where we've always been behind other industries at utilizing these sort of technologies. It's a very exciting time. And this is where money is going to develop these solutions. Secondly, I will add to that, as students, you can certainly use generative AI for bad things like making up research and stuff like that, but only use it for good things.
Don't give them ideas.
So be good and you will always have jobs in health IT.
Honor code.
I love that.
Yeah.
All right, Eleazar.
So I would say that if you're a student here and you have, you actually, you think you might be busy, you're going to be much less busy than when you start working. I would say you should really take the opportunity to develop building skills, because with the AI and it doesn't take much to be able to actually build products, build software, build tools completely yourself, without needing to find computer scientists or anything like that. And I think that's something that will if you can build your own prototype, that gives you a real edge over other people.
Wonderful. All right, we are now going to open it up to questions. So please raise your hand. Are we going to pass mics around? We've got 2 in the back.
Hi there. Thank you all for coming, by the way. I just wanted to ask a question about, how do you see AI potentially facilitating a shift from like fee-for-service in healthcare to potentially a value-based healthcare?
Paul, you want to take that?
Charge capture and revenue cycle aren't really my thing, but I think the fee for service is something that has to be legislatively changed. Like, we need to change our whole system and what we incentivize. We still incentivize fee for service, so I don't really know how you get to value-based care through AI without a total reorientation of how we reimburse. And
Yeah, I'll also add to that, Paul. I will say we have to stay very intentional and disciplined about the fact that AI and generative AI, all of these are tools to get us to a bigger goal. So I think, again, when you look at value-based care, there are multiple things that are going to help facilitate our ability to get there. I think AI can definitely understand populations, analyze, have much more customizable solutions for geographies, for particular populations. Generative AI can make that digestible and can make it personalized. But they are ultimately tools, and there are many tools that we have to employ as we look towards getting to value-based care.
yeah, just to add a little bit to that, I think it goes along with using AI in population health. And I'll use an example from UCLA. We have our own Medicare Advantage population, and we're incentivized. Well, of course, we want to do good by them. We want to make sure their health is optimal, but we are also incentivized on a financial level to make sure we avoid things like readmissions and missed appointments and what have you. We have 2 AI models in use actually to prevent that. One does specifically what I said, which it predicts their risk of readmission or ER visits over the next year. And that enrolls them in a proactive care plan where they have more eyes on their charts, more follow-up and better follow-up. And so, yeah.
Just to show you how much progress has been made, just over a decade ago, when I was responsible for readmissions in our population health programs at UCLA, we actually had paper and pen assessment tests that we would actually have the patients do to then try and come up with a score that was not normalized at all by anything else. So love to hear that we are past that at this point, Paul. We had another question there.
Yeah, thank you so much for taking the time today. I have a question regarding the identification of undertreated populations that are going to be uncovered by a lot of these AI tools. We've discussed some of those today when Dr. Eleazar was talking about genetic identification, for instance. When we think about those undertreated populations starting to be recognized, they're going to enter an already stressed healthcare system with capacity limits that are already being reached. How do each of you see that being addressed using also these types of tools?
Nick, do you want to?
Sure. So I think from kind of the corporate side of it, there is a lot of focus on health equity initiatives, and to be able to address some of these population issues that you're talking about. We just kicked off a study at Dexcom to look at inequity in diabetes care across various populations. So I think in the future, the way that AI can help impact that is pointing those things out to us sooner versus right now it's still, I'll be honest, pretty manual to have to do that research and come up with that information. So I think that once we weave in AI to be able to tell us proactively what's happening, it'll allow us from a corporate strategy standpoint to build programs ahead of time instead of in a reactive manner where you're having to say, hey, instances of type 2 diabetes, we realize African Americans are 60% more likely to develop it. What are we going to do about that? If we have the data earlier, hopefully we can prevent it from getting to that kind of divide.
I'll add briefly to that. The other way that I see AI factoring into this is when you think about sort of like healthcare deserts, and we even saw parts of Los Angeles, there are so few clinics per population. When somebody needs perhaps a specialist, and really the closest specialist in neuro-oncology is, 500 miles away, their primary care provider will have access to a very good, intelligent chatbot to work with. And you guys can go to ChatGPT and you can get a differential diagnosis better than I could make for your child. And I'm being realistic. That's just how it is. I'm waiting for the day when people start bringing in differential diagnoses for complex patients and talking through that with patients.
I also will say the assumption there is that we are going to expect delivery systems to continue to deliver all of that care. That as we move forward, some of that is going to go out into the communities. And we've seen a little bit of that evolution over time with some of basic monitoring and management of diseases like diabetes or hypertension moving to the retail pharmacy side. But today, there are a number of startups that are looking at, for example, a number of innovative solutions, like how do we leverage barbershops and nail salons to actually do basic screening for things like blood pressure and diabetes. And then depending on where the results are, how do we actually get those people connected with a pharmacist? And then if you're kind of outside the algorithms that a pharmacist can manage, then go to the healthcare delivery system. So I think it also democratizes our ability to be able to care for people in other settings of care for the vast majority of what people need. Got a question up front?
Hi, thank you for speaking today. I'm a resident physician here at UCLA, and I was wondering, something that you said that stuck with me was just the idea of being skeptical, even of the AI that we're using that makes our lives so much better. One thing that I use daily is open evidence, which gives me both differentials or answers to my questions, but also provides citations and research to back it up. That helps me feel a little bit better about the AI that I'm using. I'm wondering what other types of tools you've used to build trust with your stakeholders or physicians, or I know you mentioned that was one of the greatest barriers in developing AI tech. So that was something I was wondering about.
Sure. So I can take a quick stab at that one. I think from a development perspective, what we've done in a lot of instances to build trust is make sure that physicians are helping us build the AI models. So that I think helps build trust with sort of your development group. Because remember, any AI model we're talking about is built by people, right? So it has these sort of potentially inherent biases because of that. So it's always going to be something you have to have a healthy level of skepticism about. But I think from my perspective, that's how we've always built trust on the R&D side, is that it's never been just BD or NuVasive or Dexcom building an AI model and then handing it to clinicians. They're involved every step of the way. So they're really dictating what it will do and what data it needs to see to be able to be trained on. And I can only speak from obviously the places that I have worked, but I would expect that would be the standard across the device industry at least.
Wonderful. We've got time for one final question, and we got one right here.
Thank you so much. Is there any publicly available medical AI, for example, deep understanding of medicine, digital pathology, genetics? So, or is there any consortium? It can be from institutions and also private companies. So if there is any this consortium, they can just mainly focus on the medical AI.
The real strange thing about that question is it has to do with these kind of domain specialized models versus like the general models. It appears that the general models actually outperform a lot of these domain specific models, right? So my understanding is that to most of these, available systems, you can upload, pathology images and ask for diagnoses and things like that. Even though there's specialized systems that have been trained on that, there's this weird, phenomenon that these massive models are just training over all that data, and there's plenty of medical data that's included there. So, I think that your question shouldn't really be like, is there a specialized system? I think that we want to understand kind of knowledge about what has been evaluated, where's the best performance, what are trusted sources that can say that, this is actually working well, and what kind of validation did they have? And so that I think is the right way to think about it.
So significant gaps and challenges along with impactful innovations. The responsibility and the challenge is all laid on all of us to really take this and look at how can we make health and care better for everyone in the US and across the globe. Thank you for being here. Please join me in thanking our panelists, Dean Bernardo.